Good afternoon and welcome to our OakBend Medical Center Happy Hour podcast. My name is Donna and I am your host. Today we have a very special guest. Dr. Edward Uthman is the Medical Director and Pathologist at OakBend Medical Center. With over 43 years of experience in anatomic and clinical pathology, he has dedicated his career to the physicians and patient care. He sits on the board of directors at OakBend Medical Center and serves on many committees, a former chief of staff and physician of the year. He is the doctor that patients rarely see, but his department is one of the most important. Many hospitals do not have full labs on site. However, under Dr. Uthman's direction, OakBend has achieved that. As of late, Dr. Uthman has been busy serving as the COVID committee and assisting our physicians and staff on the navigation through COVID. Dr. Uthman, welcome. We're glad to have you today.
Thank you. It's great to be here.
So that all our listeners understand, what does a pathologist do and why is it important to have a full lab on site?
A pathologist is a medical specialist, just like an internist or a surgeon. You start off with a medical degree, either MD or DO, and then you do 4 years of residency. You sit for a board exam, and then you become board certified in pathology. There are two branches of pathology. Anatomic is what most people think about when they think of a pathologist. On TV, you see them mostly doing autopsies. Most pathologists don't do autopsies. Most of us are involved in making diagnoses on specimens taken from living patients. And that's what most of my day is spent doing, looking at tiny biopsies that usually the radiologist sends me, and I have to decide if it's cancer or not, and if it is cancer, what type it is, and do some other studies on to see what kind of modalities for treating it might be appropriate. Clinical pathology is the other branch of the specialty, and that involves the medical directorship of clinical laboratories. And the laboratory, of course, is that department in the hospital that looks at specimens, typically blood specimens and body fluids, makes measurements and examinations of those specimens to help the attending physicians diagnose and treat the disease. And the pathologist is responsible for the quality of the laboratory measurements and laboratory results, and also is responsible for the medical, clinical aspects of the laboratory.
That is amazing. And Dr. Uthman, I want to personally thank you and your team. We have an amazing pathology department at OakBend. I've heard doctors describe it as Dr. Uthman is one of the most important doctors in the hospital and the one that nobody ever gets to see. So we want to thank you for your work in that department.
Thank you.
As of late, you have been very involved in our COVID pandemic, especially at OakBend. You've served on the committee, you've worked with other doctors to form plans and make things work. What kinds of testings do we do for COVID, and are they accurate?
So we have two tests that we do to diagnose the COVID infection as it is occurring in the patient. Both of these tests are done in-house, and they're resulted out within an hour of when the lab receives a specimen. The first one is called the direct antigen test. This is a way to look at the protein products that the virus produces as it colonizes and invades the lining of your nasopharynx, which is the part of your throat that's behind your nose. So a swab is taken from that area or from the nose itself, and we look for the antigens or the viral products in that specimen. The other test we have uses a similar specimen, also a swab from the nasopharynx, but that's called a molecular test. And you're not looking for protein products that the virus produces. You're actually looking for the genome or part of the genome of the virus. So if the virus is there, its genome, and in this particular virus, the genome is RNA, not DNA like ours, but it's RNA. And we're able to determine if that RNA that's there is viral RNA, and if it is, we turn out a positive result. Both of these tests are very specific, so a positive result, you can bank on that. A negative result is a little more iffy. And I don't like to oversell anything that we do, because pathologists, we see everything that falls through the cracks and all the exceptions to all the rules. So I like to say that I wouldn't expect more than about an 80% sensitivity for either of these tests. So if you get a negative result, probably is negative, but there is a reasonable probability that you do have the infection, and it has to be treated as such, depending on the clinician or the doctor's assessment of the patient's clinical situation. So generally, I'm saying specificity is excellent. If positive results, great. Sensitivity, I wish it were better. It's a good test, but it's not great.
Okay, so if you go and have a test done and it's negative, but you're having all the symptoms and you're still not feeling good, everybody needs to go back to their doctor and really discuss it with them.
Right. And it all depends on the instance of the disease. So in a world before the pandemic, when severe coronavirus infection was extremely rare and influenza was really high, if you had flu-like symptoms, you almost certainly have the flu. But now coronavirus is so much more prevalent than influenza that when you have influenza-like symptoms, you probably have coronavirus. So a lot of it depends on the experienced doctor and what experience they're having with the local population as to what they're going to be suspicious of and what they're going to rule out early on in the course of the patient's management.
Good information. Now, we have antibody tests, and we've heard people talk about antibody tests. Can you explain the antibody test, and what do we do with the outcome of those tests, and how prevalent it is, I guess?
So most labs do have an antibody test. Now, when any foreign substance, living or not, comes into the body, if it's a complex molecule like a protein, it will cause the immune system to respond. And one of the responses is to produce antibodies, which are big protein molecules that circulate around in the body fluids and attach themselves to the antigens, or the parts of the pathogenic organism that engendered the antibody response in the first place. So we can measure those specific antibodies. In the case of coronavirus, yes, we do have an antibody test. The problem is it's not useful for many situations. For instance, if you're sick with coronavirus, your antibody test may not be positive because you haven't yet mounted an immune response to the virus. And you can also have had a subclinical or an undetected COVID infection that caused an antibody positivity test. So you could be sick with something else and have a positive antibody test for coronavirus, but you don't have an active coronavirus infection. So for that reason, I don't promote the antibody test. If a physician calls me about it, we discuss it. In fact, there's really zero demand for the antibody test. So I think it's probably useful when doing studies of populations and doing public health studies, but for the individual patient, I don't think it's really that useful. It does not,
Okay.
if you have a positive antibody, it does not mean that you can't get coronavirus. You can have a positive antibody test and get an active infection. Sort of encourage people to not order it unless they really know what they're doing.
Okay, because people have been asking a lot of questions about it and that, so that kind of clears it up for them. So now the vaccines are here, and it's something everybody's waited for, but yet it's come with a lot of apprehension about the safety of it. Can you explain to everyone about the vaccines and the safety of it, and what's your take on it?
Let's just step back and talk about vaccination in general. Vaccination is literally more than 200 years old. As far as I can tell, it's the oldest scientific-based medical modality that there's ever been, period. There were practices that went on a lot longer than 200 years, but they weren't science-based. This is science-based. We have enormous, unparalleled experience with vaccination. Overall, if you look at every medical modality that's ever been devised, in my opinion, the greatest number of lives saved and the greatest number of years of life saved can all be attributed to vaccines. there's no other medical modality that's even close to that effectiveness. Why are people afraid of vaccines? There's only one reason that people are afraid of vaccines. In 1998, a paper was published in the British journal Lancet that made the claim that the measles, mumps, rubella vaccine given to children causes autism. This has been thoroughly debunked. The years following that, the author of the paper, Andrew Wakefield, had his license revoked in the UK. The Lancet has recalled the article and printed a disclaimer. All of the article's co-editors, except two, have retracted what they said. There is no basis for the anti-vaccine movement other than that one paper, but that's all it took. All it took was that and some Hollywood stars, and now we have a substantial number of the population, many of them otherwise very well educated and sophisticated people, who are not getting their children vaccinated, and this has set up a whole culture that's anti-vaccine, and it's all based on a lie from 1998, thoroughly debunked and retracted, but here we are. That's why people are afraid of vaccines.
Wow, that's interesting. So let's talk about the benefits of the vaccine.
Well, there's, of course, most of us, at least until the anti-vax movement, we were all vaccinated routinely as children, and vaccines that adults need too. So the benefits are is they greatly reduce the incidence of certain infectious disease. Now, most of us of a certain age, at least, are getting flu shots every year, and that vaccine varies greatly in effectiveness. It can be, it can have an effectiveness below 50% or effectiveness that's considerably higher depending on the strain of flu that's circulating around that year. Now, the coronavirus vaccines, and there's two that have been approved in the United States so far, the Pfizer and the Moderna. These are enormously effective vaccines. They give the figure of 94, 95%. The thing is, the number of people who were vaccinated that actually got sick are so small that those figures are very granular. I mean, it's an enormously effective vaccine. It's not 100%. There's nothing in medicine that's 100%. But when you get to 95% effectiveness, that is some good medicine. So that's what it does. It keeps you from getting a clinical infection with coronavirus. Now, what we don't know is if you've been vaccinated, can you get a subclinical infection? That is one where you have the virus in your mouth and nose, wherever, and you can spread it around and you never get sick. That's what we don't know yet. We don't know if the vaccine prevents that, but we do know that it's very effective in preventing you getting sick with coronavirus.
What if you have other illnesses like heart disease, cancer, diabetes? Would you take the vaccine?
Yes, you would especially want to take the vaccine in those scenarios, because if you otherwise do get coronavirus, you're more likely to have an unpleasant outcome.
So everybody gets the vaccine. Do we still have to wear masks and take precautions?
We do, to protect others, because we don't know if the vaccine keeps us from carrying it around silently. Now, I suspect that in a few months we're going to learn that, and maybe we'll learn at some point that the vaccine eliminates viral carriage totally, and we don't have to worry about it infecting other people. But at this point, yeah, I'm vaccinated, still wearing the mask. I'm still observing social distance. I'm still not, getting into crowds, especially indoors.
And if I've had COVID, do I still need to take the vaccine?
That's a good question. Yes, I'll say yes, because we don't know how protective the antibodies that you naturally acquire from getting the COVID infection are. I have seen information that the titer or the level of antibody you get from the vaccine is much higher than we see in people who have had actual COVID infections. So the vaccine, at least in terms of producing one antibody against the spike protein of the coronavirus, which is what these vaccines do, it's much more effective than having had the disease and having achieved natural immunity. So yes, even if you've had coronavirus, you should get the vaccine. Now, some people are waiting 90 days because they don't want to stress their immune system that much. So after they have had the infection, then they wait 90 days and get the vaccine. That's probably safe because we have seen little or no evidence that you can get reinfected within 90 days. So you're probably safe in doing that. And I wouldn't argue against that. Although, as far as I know, the FDA does not list it as a contraindication to getting the vaccine. The vaccine is pretty much a universal recommendation.
Dr. Uthman, everybody's getting advice over social media and all these other avenues, and everybody's a little worried about, I'm going to get the vaccine and I'm going to end up with COVID, or people are having bad side effects and they're dying. We at the hospital have given our first responders, physicians, and firemen and everyone over 1,000 vaccines. Have you seen any traumatic side effects from this vaccine?
So the response to the vaccine is highly variable. Now, I got both with the first and second doses of the Pfizer vaccine, I got a slightly tender injection site on my shoulder that went away within 48 hours. That was it. One of my partners, who's 20 or 30 years younger than me, had a systemic reaction where she felt like she was getting the flu. She got a temperature up to 102, and she felt achy. And that can prevent you from going to work. But those symptoms will resolve. And here's the way I think about that. If that's the way your body reacts to a single virus antigen, which is the one that the vaccine introduces, how is it going to react to millions or billions of viruses producing their full panoply of antigens, of all the bad things they produce and invading your system everywhere? So to me, when somebody has a very severe systemic reaction to the vaccine, which it always goes away, I think about how much luckier they are than if they had actually gotten a coronavirus infection, in which case that would have probably ended in the ICU or the morgue.
You are exactly right. And we've watched a lot of traumatic cases of COVID, and we've watched some really good ones where people did real well. It's only as bad as you're the victim of one of the bad cases, but it is real, and people need to understand it is real, it is spreading, and we really need to do something about it. Now we have vaccines. Would you like to expand on anything to educate as we close this, educate our population on anything you'd like to know about COVID or breaking the fears, or just give a final statement?
I would, but I would like for them to educate me. I want the people that are declining the vaccine, and by the way, doctors are not declining the vaccine. Almost every doctor that I've talked to, online or in person, has taken the vaccine and clamored for it before it was available. But the people that are refusing it, I want to know why. Where is this coming from? Because any of the reasons that I've been given, they're contrary to fact. So some people, I guess, are saying, well, the vaccine has RNA, so couldn't that get into the human genes? So because you're taking a tiny portion of RNA from the virus and injecting it, and then your cells build some of those viral antigens, or one viral antigen that produces antibodies that interferes with actual infection by the virus. So there's viral RNA in your cells for a while, for a very short period of time until it degrades. There's no way that viral RNA can be incorporated into human DNA. It's confusing because there's another type of virus that we're all very familiar with that does do that. Those are called retroviruses. And the most popular, if you want to call it that, retrovirus is HIV. Viral genes do get incorporated into host cells, and people are surprised when they learn that about 8% of the human genome originally came from viruses. That's something to really think about. But those are different types of viruses. The virus that causes COVID is not that type of virus. There is no way there's any molecular way for that virus genome to get incorporated into our genes. It's just not possible. It's not a feature of that type of virus. So that's how I answer that objection. The other things, I don't know where they come from. I would ask people just to tell me in the hallway, why don't you get the vaccine? Tell me why you're not. Let's talk about it. That's what I really want to do. That's how I want to spend my time.
Okay. Well, we do have an email set up to where you can email on this podcast, and we will be glad to get these questions to Dr. Uthman.
I'll be happy to answer them, you bet.
Great. We encourage it. We want everyone to be safe. We want everyone to be prudent, and we want you to have the right information so you can make the best decisions for your health. Dr. Uthman, I want to thank you today for joining us. You have been a great guest. I'd love to have you back on. And I want to thank our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week. Thank you.
Thank you for joining us today on OakBend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.